Who gives the thumbs up here? Ready? Great. Good afternoon.
Good afternoon.
Yeah, really. Yes, we should wrap this up. I'm Secretary for Health and Human Services for the great state of California, Mark Galley. It's a real pleasure to be with our friends and partners in San Diego here at Alvarado Hospital. Really, today is a day where I just feel a great deal of joy, gratitude, and humility. It's a day where I am standing on, kneeling on shoulders of such amazing leaders from the past couple of decades who've helped guide California's vision for behavioral health. Nearly 20 years ago, we as a state went to the ballot and decided to pass Prop 63, the Mental Health Services Act, as a commitment to doing right by people who were so often walked by and overlooked, who, because of their behavioral health conditions, languished on streets, in jails, in and out of hospitals, on all sorts of holds, as we've talked about. Really trying to figure out where we're going to go as a state. And the state, in those 20 years, has done some amazing things. We've fully adopted the Affordable Care Act. We're one of the states with the strongest commitment to mental health parity law. Under Governor Gavin Newsom, we have transformed what Medicaid and specialty mental health care in our counties and our Medicaid managed care plans does for individuals. All of that coming since that day 20 years ago when Prop 63 passed, a very meaningful, strong message over the past 2 decades of our commitment to the behavioral health conditions of Californians. But today is a day that we celebrate because it is the beginning of the next stage of reforms in behavioral health that we'll be talking about today, looking at that act from 20 years ago and how does it need to be transformed and reformed. How do we use the dollars differently? How do we make sure we return to the original set of priorities envisioned by the authors and the voters on that day and in that year, nearly 20 years ago, to focus on those with the most severe behavioral health conditions in our state. And that means refocusing how the dollars are used, focusing on what one of the most important social drivers of health for people with serious behavioral health conditions is, which is housing. How do we use these resources to get more people housed? We know in the clinical world it's almost impossible to serve somebody who lives under a bridge or in a tent in an encampment. We need to get that housing available and connected to the services that also come as part of this reform, focusing on those wraparound services and building the workforce and the capacity to deliver those. You may ask, well, where do all the settings come from? We know. We just heard stories about patients who don't have the next place to go after they get admitted to this hospital. I know many of you work in community where you wonder, how can we get more of those settings, more of those treatment slots? The governor is suggesting today that we move forward with another bold idea for California to bring the resources to build those beds. On top of that, we're going to talk about what is often overlooked in the shadows, people with substance use disorders, the fact that this act in its transformation is going to allow us to serve those with substance use disorders in ways that we've never been able to do before, recognizing the stigma, recognizing the disability that comes with severe substance use disorders, and being able to use these resources to treat not just those with mental health issues, not those with co-occurring disorders, but those with substance use disorders. And although we're here to celebrate these 2 major concepts, the reformation of MHSA, the movement forward with dollars to build up that continuum of step-down beds that we know we need across this state, we're also here to start talking about how it's not just the specialty behavioral health services that need reform. We need to, everyone in this room today has access to care and services to focus on wellness, early mental health and substance use disorders, and that our commercial health plans, our Medicaid managed health plans, and all of us in specialty mental health working together to increase and deliver on the promise that we make every single day to Californians that we'll be there in the vision of a true California for all. Today's announcement is furthering that, and I'm really proud to be with the group of leaders that will be speaking next to talk through and share a little bit more. So with that, thank you, welcome, and it's my great pleasure to introduce a friend, a colleague, somebody who has been a thought partner on so many things that we've done together, Secretary Lourdes Castro Ramirez.
All right, I feel very tall. Good afternoon, and Secretary Gali, it is a pleasure to work with you every single day, forging housing and a health and human services framework as we continue to address homelessness. Thank you, Governor, for your trust and leadership. I'm Lourdes Castro Ramirez. As Housing Secretary, I serve with Secretary Gali as the co-chair of the California Interagency Council on Homelessness, where we're working across state government to prevent, address, and end homelessness. We all know that housing is key. It's fundamental in the work that we do. It affects health outcomes, quality of life, and the ability to reach our potential. Yet, too many Californians lack a safe, affordable, and dignified place to call home. This is largely due to the high cost of housing and the limited supply or the shortage of housing. And this pressure is acutely felt by low-income families, individuals on fixed incomes, and low-wage workers. Since day one, the Newsom administration has made increasing affordable housing and addressing homelessness a top priority, an all-of-government approach. Making this a priority has required new land use laws, new partnerships, and new tools to build more housing more quickly. And it's working. California has financed the construction of 60,000 affordable permanent homes across the state, and we have 20,000 more that are in the pipeline. As we work with communities to build more long-lasting housing that is durable and that will be here for generations to come, we're also expanding the full spectrum of supports, as Dr. Gali mentioned, and building a more robust continuum to ensure that unhoused people receive the level of support and access to interim and permanent housing. This requires all levels of government, federal, state, and local. So thank you, Governor Newsom. Thank you to the members of the legislature, to local leaders, to our federal partners, for continuing to prioritize the housing and health needs of all Californians as we work to create more places for people to call home. Now I'd like to share a few remarks en español. Muy buenas tardes. Muchas gracias, Dr. Gali, por tus amables palabras. Yo soy Lourdes Castro Ramírez. Como secretaria de Vivienda, trabajo con el secretario para prevenir y terminar con la falta de vivienda como coordinadores del California Interagency Council on Homelessness. Todos sabemos que tener una vivienda es fundamental. Afecta a nuestra salud, la calidad de vida y la capacidad de alcanzar nuestros sueños. Sin embargo, demasiados californianos carecen de un lugar seguro, a precio accesible y digno. Esto se debe en gran parte al alto costo de la vivienda y la falta de vivienda disponible. Y esta presión afecta mucho más a las familias de bajos ingresos, a las personas con ingresos fijos y a los trabajadores con bajos salarios. Desde el principio, la administración del gobernador Newsom ha declarado la construcción de vivienda como su prioridad número 1. Hacer de esto una prioridad ha requerido nuevas leyes, simplificar la burocracia y nuevas herramientas para construir más vivienda más rápido, y estamos obteniendo buenos resultados. California ha financiado la construcción de casi 60,000 viviendas permanentes a precios accesibles, y tenemos más de 20,000 viviendas en la fase de planificación. A medida que trabajamos con las comunidades para construir más viviendas permanentes y duraderas, también estamos ampliando la gama completa de apoyos para que las personas que enfrentan falta del hogar puedan obtener viviendas seguras y con apoyo. Esto requiere la participación de todo gobierno, del federal, estatal y local. Y gracias al gobernador Newsom, miembros de la legislatura, líderes locales, gracias a ellos por continuar dando la prioridad que se necesita para poder resolver este desafío. Ahora me gustaría darle la bienvenida al supervisor del condado de San Diego, Nathan Fletcher. Now let me introduce County Supervisor from San Diego, Nathan Fletcher.
Thank you. Thank you very much. Good afternoon, everyone. Governor, we welcome you to San Diego. We appreciate you being here at Alvarado, an incredible county partnership where we're working to expand our behavioral health services. I want to take a moment to recognize, you'll hear from in a minute, Mayor Steinberg, 19 years ago, authored the original Mental Health Services Act, and has been incredible. Our legislative leaders, the President Pro Tem, Senator Atkins, and Assemblymember Ward, and other legislative leaders. And, you know, everyone is here today. There is a great commitment to adhere to a belief that individuals struggling from behavioral health issues, mental health injury or illness or addiction, need to be afforded the same access to care and a quality life as anyone else is. We would never accept for a minute a system that said if you broke your leg and you need an appointment, that it would take 6 to 8 weeks for you to get an x-ray, a cast, and a set of crutches. But that's the system we have today for many individuals who are suffering from mental health injury or illness. We would never accept a system that would tell the diabetic, we're not going to give you a monitoring device and insulin and advice on the front end. We're going to wait until you go into diabetic shock. Call 911 and come to the emergency room, and at that point we'll help you, but only for that period of crisis. But that's the system that we have today, because we've inherited collectively a system that does not reimburse, staff, fund, cite issues of behavioral health in the same way. And that is the challenge that's in front of us. And with the governor's leadership and legislative support, that is the system we're trying to change, to make sure we can provide the right care to the right person at the right time, to give everyone an opportunity to confront whatever challenge or issue they face and live a sustained and whole life. But we also know that absent housing, no level of service will be effective. And so the efforts that are being proposed here today on the Mental Health Services Act, on the bond funding, on these things are vital and key and central to our ability to fulfill that basic human right of health care. And when I say health care, I mean health care including behavioral health issues. To the extent these things call for counties to do more, as a county supervisor, I'm here for it. Require counties to do what they need to do. Hold counties accountable. Make us be transparent. And if we don't do what we need to do, then penalize us. Because the days of allowing people to get there on their own are the days that need to be behind us. It is time to ensure that the folks who need the care and help, that it is available. And standing here at Alvarado, this is an incredible example of what can happen. Here we have our county government in partnership with our healthcare providers to say, how do we increase the availability of inpatient psychiatric beds? How do we increase the availability of crisis stabilization units? How do we provide outpatient treatment, care coordination, case management in one location? But this facility being expanded with government partnering with our healthcare providers allows us to take our existing psych hospital and transform that into subacute step-down bed capacity, something vitally needed. And then it allows us to take Third Avenue, another piece of the component, to build long-term residential care, to alleviate the burden on our hospitals that are bearing so much of the burden of individuals with nowhere else to go. But projects like these three together are not possible absent the dedicated funding, absent bond funding, absent the ability to move swiftly and quickly. And so I stand here today in full support of the governor's initiative and what they're proposing. and in recognition that we will have to do this and more, to not just have the structure, to not just have the site, to make sure we have the staffing, to make sure we have the services. And so every day I'm encouraged at the direction we're heading, but we all have to remain incredibly impatient, that we have to go faster, we have to go bolder, we have to go quicker to get to that point where that individual suffering has the services that are available to them, and get out of the mindset of a crisis level of care. Well, we wait till you're in a state of crisis and then we stabilize you and then we discharge you right back to where you were and wait until you're in a state of crisis again. That's not good for that individual. It's not good for the taxpayers. It's not good for our family members and loved ones. And so that's the system that we're trying to change. And I'm honored to be here today and really tremendously appreciate, Governor, your long-term commitment. This is not the first time you've weighed in on one of these issues. It's not the first time you've been there to tackle issues of mental health and addiction and homelessness and housing. And we at the local level are incredibly grateful for it. We're also grateful for legislators who step up that are willing to author and tackle some of the most challenging and tough issues. And it's my great honor to have with us here a tremendous leader in the state Senate who has really pioneered a lot of landmark legislation and been willing to lean into these fights. And so it's my great honor to introduce and welcome to San Diego State Senator Susan Eggman.
Good afternoon, everybody. It is my great honor to be with you here today with the governor as he makes this new announcement about another way we're going to get things done. And this change doesn't come in isolation, right? For the last few years, we have been working nonstop under the governor's leadership to really advance things like CalAIM, right, where we're going to be able to use Medi-Cal to pay for housing, to pay for different things for people, where we're going to stand up an entire behavioral health system for kids, 0 to 25, that anywhere, anytime can get a behavioral health assessment, where we're doing it in conjunction with Care Court that we passed last year to really take those sickest of the sick and bring them in and, as the supervisor said, hold counties accountable. What we see on our streets, those who are the most ill should not be at the back of the line. We know they're the most difficult to treat, but they should be at the front of the line. And these kinds of innovations that we're doing now does just that. We know we need housing. I grew up in a family with a dad who had a heart of gold, and we didn't use culturally appropriate terms, but there was always somebody living behind his shop, whether they had substance abuse issues, mental health issues, ID issues. There was always somebody there who would help him at his store. He had a little fruit stand. That's the kind of way I grew up, and I have a 14-year-old daughter now, and when we see what we see on the streets right now, and she says to me, Mom, why can't we do better? Right? It's not the days when I grew up in the 60s where it was 1 or 2 and people could help. It is so overwhelming that Californians feel disillusioned. We feel disillusioned that our government can't work, and we don't have the empathy or the capacity to change that. That is wrong, and we are doing that now. I am so proud to stand with this governor and Dr. Galley and the supervisors and everybody who has come together to say we can and we must do better. When we passed MHSA under Darrell Steinberg's fantastic leadership 20 years ago, it was a fantastic start. The economy fell out after that, right? Everything fell out after that. Housing went away. The clubhouses went away. All those places that were supportive all over the communities, those all went away. And where did people end up? In ditches, in canals, in riverbeds. This is the time to stop it. I took my daughter to see the theater in San Francisco a few years ago. You know what her big takeaway was when we went to see Annie on Broadway? Was the condition of people on BART. Was the condition of people on BART. And she would talk descriptively about it. I won't hear. But that is not, we can do better than that, and we must. So this actually delivers on that, not only to pay for the construction of new housing, those step downs, those communities, those villages, because we all know we all want to be a part of something. We all do better when we're in community with each other. If it's helping a man at a produce market, right? Or if it's helping in a kitchen, whatever it is, we do better in community. This will provide the funding for those beds. I just talked to a group of social workers Friday. I'm a social worker by training, who said, Dr. Eggman, we have people here for 6 months in an acute care hospital because there's no place to send them. They're elderly. They have no place else to go. Our hospital systems can't take that. We're facing a crisis. So this kind of leadership that says we are going to build beds and we're going to use part of our resources to pay for those services is the next step that we need to do in this entire continuum of care that we've been working on with all of you, with the families, with the providers. We're gonna make the promise to California come true. And so I am proud to be a part of this. And I'm also proud of the leadership that stands behind me. And with that, I'd like to introduce one of my colleagues, Assemblymember Chris Ward.
Well, thank you, Senator. Really excited to be here with Governor Newsom and administration leaders as well, to be able to welcome them to San Diego for this topic and these important announcements here today. As the Senator had mentioned, and really to underscore some of the investments that we have been working on during some pretty good budget years, more than $4.5 billion to help a behavioral health care system, ensuring that that all individuals have fast and easy access to mental health and care and substance abuse services is great, but it's just a down deposit, a start on right-sizing the system to meet the mental health needs fully in our communities. That means on our streets, in our homes, in the workplaces, and in our schools. But the need is great, and we know that the calls for action from our constituents are greater. Our workforce needs thousands of trained specialists in sustained careers, and we must support our counties and our nonprofits with not just one-time funding, but those ongoing resources to expand services for populations with serious mental illness. So I'm particularly excited for today's announcement that's going to be able to help that issue for ongoing housing and treatment support for mental illness and substance abuse, where clients can have individualized care settings that will help them stabilize and then be able to plan forward for their next steps. And then we're not going to wait for the future. The legislature is acting right now on a lot of policy to send to the governor. I'm proud to join author one, just by example, AB 1316, to require Medi-Cal plans to cover necessary care for an emergency psychiatric condition, so those in need aren't turned out into the streets but approved for specialized care and warm referrals in the middle of the night. And there's a lot more in motion that committees are just getting to work with underway right now. But even under a constrained budget situation, the Assembly's budget blueprint is committed to support growing public health investments for counties to continue expanded services, including Care Court, like we heard, where we're proud San Diego County stands to be among the first to roll out. And yes, accountability is everything. So we have to make these public investments work. And we're going to continue to make sure that we oversee efforts to improve the quality, value, and service of behavioral health care programs and reduce punitive or bureaucratic barriers to programs that serve California's most vulnerable. So I want to thank the governor and the administrative leaders that are here today for their priority focus on mental health and housing. It will save lives, and it's the answering to the priorities here in San Diego County. And it's my pleasure to welcome up a former legislative leader, but importantly, a mayor in the state of California, who, as you heard, is the author of the Mental Health Services Act. Would you welcome Sacramento Mayor Darrell Steinberg?
Thank you so much, Assemblymember Ward. What an honor to be here. I want to thank the governor and his team. I want to thank the legislature for leaning in like never before with the governor to make mental health a priority in this state. Those who know little about California history know this. They know that in the 1960s and 70s, that the state made a well-intended decision to shut state mental hospitals and to build a decent system of community mental health care. They also know that that promise to fund that decent system of mental health care did not happen for decades. In 1998, I was elected to the Assembly from Sacramento, and I think people might have referred to me back then as a young whippersnapper who decided that it was time to at least try to fulfill that promise. And in my first several years, I introduced what were known as the AB 34 bills, integrated services for the homeless, mentally ill, and we got to $55 million a year out of the state's general fund to do just that. The results were outstanding. Assertive outreach, whatever it takes to help people living on the streets. It was so successful that in 2004, we decided to go to the ballot and to seek to impose a millionaire's tax to fund public mental health. Prop 63, known as the Mental Health Services Act. It was the first of its kind, and it saved the mental health system, especially the public mental health system, in many ways, especially during the years of multiple recessions. It also pioneered a number of very important innovations, like No Place Like Home, using a portion of the money to build a bond, $2 billion for affordable housing, supportive housing for people with severe mental illness. Full service partnerships, the idea that we fund whatever it takes, the wraparound service model, because people living on the streets with severe mental illness have a number of challenges that need to be addressed. But as the fund has grown to $4 billion plus a year, 20 years later, it is time, and I say this as the author of the Act, it is time to modernize the Mental Health Services Act, to apply what we have learned, and to meet the great challenges of our current time. For me, there have been two main lessons learned over the course of the last 20 years. Up until now, and this governor, Governor Newsom, the state has not made mental health a priority, if we're going to be honest about it, and has not pushed for more focused priorities with the counties, who are the entities responsible for delivering health and human services in our state. The second lesson learned is that there has not been nearly enough money or focus on chronic homelessness, on tent encampments, and on the criminal justice revolving door. It is time, it is actually far past time, to stand behind prioritizing these dollars in a more effective way. And I say this not only as a former legislator, but now as the mayor of a large California city that desperately needs these resources to be able to make the difference that the public in all of our cities wants to see on the streets. There will be those who say, you can't change the act because we're just going to have to then cut good programs. Well, here is my response. First of all, the money is continuing to grow. This started at $750 million a year. That was a lot of money back in 2004. We did not index it for inflation. It's now, as I said earlier, up to over $4 billion a year. This is a matter of focus, and it's a matter of will, including political will. No one is proposing to take anyone's money. The governor is not proposing that. But let's be clear. This is not the state's money. It is not the county's money. It is the people's money. It always has been from the very beginning. And we know what the people want. They want us to help the people who are the sickest of the sick, who are too often forgotten, who too often are given up for dead, and in fact, in too many instances, die too early deaths. $1 billion for housing, not just one time like we did with No Place Like Home, but $1 billion every year. Enhanced wraparound services, full service partnerships, and a prioritization of the tent encampments and the people on the streets. It's time, it's long past time, and I want to thank the governor. I want to thank Pro Tem Atkins and Senator Eggman, who has legislated fiercely in this area the last couple of years, for taking this on. It is not easy. Back in my day, there were very few people who wanted to work on mental health issues. Now, fortunately, more people are paying attention, but it still takes fierce leadership. None of this is going to be easy, but it's the absolute right thing to do. Modernize the Mental Health Services Act. Thank you so much, everybody. It's my honor to introduce Anita Fisher, mental health advocate and former education director at NAMI San Diego. Anita?
Good afternoon, everyone. Thank you, Governor Newsom, Supervisor Fletcher, NAMI San Diego, NAMI California, who saved my life 22 years ago in our family. And also an honor to follow Mayor Steinberg, because it was the Mental Health Services Act that gave me the opportunity to work for NAMI San Diego, because they were able to have a contract to do programming for family members and individuals. So I'm here representing the family member voice. My son is one of those individuals who lives with serious mental illness and substance use disorder, co-occurring disorder. And because of the gaps and the holes in the system, he ended up homeless on the streets. He ended up in jail. He ended up in prison. And I would ask myself, why? Why? Why is this happening when he has a medical condition, a treatable medical condition? So the services that the Mental Health Services Act and the new programming that you're going to hear about today, many family members multiply my voice by hundreds of thousands, because I facilitate support groups and classes for NAMI, and all of the family members that come forth in those classes, they are sharing the same story of their loved one falling through those gaps and those holes in the mental health system. So I just want to say thank you, and we are so excited about what's coming because it's been a long time. Again, it's been 22 years for me, and my son is still alive, I always say, because I had to fight at every step. But he's doing well today, and I thank you. And so now I am going to introduce Ms. Antoinette Nador, Executive Director of Veterans Legal Institute.
Thank you, Ms. Fisher. I am Antoinette Nador. Good afternoon. I'm Executive Director and founder of Veterans Legal Institute, a full-service nonprofit law firm that provides free legal services to low-income and homeless veterans, the majority of whom are disabled or suffer from some sort of mental health issue. Most of our clientele survive off of an income of $2,000 a month or less. In partnership with the California Department of Veteran Affairs and with MHSA funding and the direct support of Secretary Vito Imbasciani and Secretary Keith Boylan and the rest of the CalVet staff, Veterans Legal Institute has been able to champion over 10,000 veterans across Southern California county lines who are homeless, economically disadvantaged, and struggle with mental health issues. These are often the same veterans who, absent advocacy and care, are vulnerable to becoming one of the 22 who commit suicide each day, and that is an unacceptable outcome and one we can no longer ignore. In being boots to the ground for over 13 years, first as an Equal Justice Works AmeriCorps Legal Fellow, 6 years as a JAG officer with the California State Guard, and now leading Veterans Legal Institute and military-specific legal aid, and working alongside veterans who live with mental health issues. It is clear to me that stable housing is key to keeping veterans striving and successful, and mental health issues are often the main underlying cause of homelessness and exacerbate a variety of other issues, including those involving family law, traffic and citations, economic-based issues, as well as issues with characterization of their discharge, leading them to needing a discharge upgrade so that they can access those life-changing benefits that they deserve. Now, housing and mental health are inextricably linked to everything that leads to veterans' overall transitional success, whether their challenges be legal in nature, like that we service at the Veterans Legal Institute, are employment-related, or a different type of issue. From a complex and deeper dive, these issues typically stem from mental health and housing insecurity. If veterans don't have quality, stable housing, it affects their mental health and vice versa. And that in turn affects their children and becomes a generational issue for our California communities, one that we can no longer afford to ignore. So thank you for your support and care for our heroes in need. And now it is my distinct pleasure to introduce Senator Pro Tem Tony Atkins.
Well, good afternoon, everyone. I am Tony Atkins. I am the President Pro Tem of the California Senate. And I'm thrilled to stand here with our governor. I want to thank you, Governor, for being here again in San Diego, for working with my legislative colleagues, for working with our county. This is critical work. And Anita, your story is exactly why we're here and why we continue to be here. I was a city council member 20 years ago in San Diego. And I heard the stories of my constituents. I have family stories. Many of us do. And it was that reason that when then Assemblymember Darrell Steinberg put forward this proposal, I was thrilled. You know, working in Mid-City in San Diego, we were working very hard to build housing, to provide permanent supportive housing so that we would try to address some of these issues. Of course, the mental health services needed, I hear all the time from our hospitals, our care providers, that we need more behavioral health beds. We have to have the right resources for people when they're ready and when they have the support and they need it and they can get in right away. So I was thrilled 20 years ago, and I am thrilled today. Many people have spoken. I don't need to do more than introduce the governor at this point, but to acknowledge my legislative colleagues in the Assembly and in the Senate. Senator Eggman is a leader. We have a mental health services caucus now in the legislature. And what we know is that 20 years ago, there was hope. There was a hope of solutions for all of us. And today, it is only right that we reassess how to use those resources and learn from what we have witnessed over the last 20 years. I went to the legislature in California because I wanted to work on housing, health care, and homelessness. Those three things. And so I am as committed today as I was as a city council member. And because of the partnership of the Speaker, the Pro Tem, the governor's staff, and local government, we will be able to make a change, because that is what Californians ask of us. That is what the voters did 20 years ago. And people still want solutions. And as I introduce Governor Gavin Newsom, one thing I want to say. I was a city council member. I was acting mayor. He was mayor of San Francisco. I met him in those days. And the thing that I appreciate most about this partnership with our governor is he leans in. He leans in. And he's always about trying to find solutions. And that I appreciate. That is what makes the job that we get to do each and every day so exciting. When you have someone like Governor Gavin Newsom who is willing to take a risk, to step out and say we need to adjust, we need to change things. And so I am thrilled to be here with him today. I appreciate him making this announcement in San Diego County, and I happen to believe that's because he knows he has real partners in our county, in our city, in our partnerships with organizations that are doing the work on the ground every single day, and frankly, from our residents who ask every day, what can we do? What more can we do to change this situation? And with that, I am thrilled to welcome Governor Gavin Newsom.
I need people behind me. It's a little lonely, all the speakers up here. Thank you, everybody who took the time, and Senator Eggman in particular, I'd leave. I'm grateful to her and her 14-year-old daughter for being here, and I appreciate the Pro Tem's acknowledgement of her extraordinary work, Assemblywoman Irwin, so many others. Of course, I'll brag on the other electeds that are here with us today, but in absentia, they deserve a tremendous amount of credit in helping us shape where we are here today. Look, I don't want to belabor the point. I think most of you have the talking points, as we say, in terms of what we're trying to achieve here. But let me just underscore the imperative, and that is the moment we're in. It's unacceptable what we're dealing with at scale now in the state of California, not only in terms of what's happening on the streets and sidewalks, but those that are suffering alone, those that are unseen in homes, in mobile home parks, on the streets, obviously, as well, in isolation. We have to address and come to grips with the reality of mental health in this state and our nation. The question is, what can we do more and do better? It was noted a lot of the work that we have done, and I'm proud of that. I mean, the idea that this state took the reins a year or so ago with the incredible leadership of Tony Atkins and others and set aside $4.7 billion for youth mental health, 0 to 25, comprehensive screenings, supports, and services is incredible. There's not another state, no other state has ever done anything at that level. By the way, that includes trying to identify the needs, get 44,000 counselors trained and hired. None of us naive about the workforce components as it relates to these investments. The work we have done to strengthen aspects and components, and there have been some modest efforts in that respect as it relates to Darrell Steinberg's vision under Prop 63. They've paid dividends as well. But we're still living with constraints in a system that has been set up, a system that was dismantled, as was noted, over the course of the last half century or so. And that requires us to act anew and to think about what we can do now at scale in order to address the scale and the magnitude of this crisis. And that's led to conversations over the course of the last number of years that have led to this very consequential moment. What we're announcing and advancing today is a big idea. It's a big deal. So much so that we're going to need the concurrence of the people of the state of California. We're asking them to consider with a ballot initiative the opportunity, as was stated by Darrell and others, to set aside and prioritize the most acute challenge the state faces, and that's the issue of the integration of housing and the supportive services that would need to be stacked on that housing to stabilize individuals that are in acute states of psychosis, people that are self-medicating with drug or alcohol addictions. We're fooling ourselves that if we don't address that fundamental need, that we can turn this thing around, that we can have the impact that we continue to promote. That was not originally envisioned 20 years ago. And by the way, I was proud. I was the first mayor in the state of California, at the time mayor of San Francisco, to step up and support Darrell Steinberg's vision. I remember having a press conference with him in the city, in City Hall, talking about this initiative. But we were talking about conditions that don't exist today. They're so much more acute, and they have devolved in many respects. And that requires us to look at new strategies, new interventions. Most fundamental is setting aside consistently $1 billion+ to focus on that integration of housing as a key component. Number two, we also recognize the issue of substance abuse. I was talking to a young man, a remarkable man, 5 months sober, that has been able to turn his life around, and he was talking, putting a human face on his struggles with fentanyl, and how he just said, I gave up. I didn't care. I wanted to die. I assumed I was going to die. And how he made his way out here, and how he's been able to be a model and an example, and now a peer mentor for others. The prospect of being able to turn people's lives around exists, and I want folks to know this as well, and it's important. I'm highlighting that for two reasons. Number one, that we will also be amending the Mental Health Services Act to allow for more focus as it relates to substance abuse. That was not originally envisioned with the original Mental Health Services Act. But number two, to let folks know we can turn this around. He's an example. People's lives can be changed. Forget the cynics out there that say this is too big, we'll never figure it out, we can't save all these folks. That's not true. And so I wanted to underscore and thank you for the courage of your sharing your example. And you are an example to others, and we count on you to continue not just to take care of yourself for your own self-interest, but as an example to others that it's possible to turn your life around, to save your life. So many others need to know it's possible. And what we're also advancing is a framework that I hope stretches the minds, the people of this state, that we can fix this, that we know how to do it. And so $1 billion a year, expanding the scope of what is included in terms of what was originally envisioned 20 years ago in the Mental Health Services Act, is foundational in this effort. Working with the cities and counties, thank you, Nathan Fletcher, as a county leader, for asserting with clarity and conviction a recognition that all of us are in this together. And there's no assault. This is not an attack on the counties. This is about an open hand, not a closed fist, about a partnership that needs to be established where we can all be more accountable to one another, ultimately to be more accountable to you, the people of this state. And so we look forward to working with the counties as we work out the details of this legislative package and move it forward with the voters in terms of reprioritizing. Number two, the big idea is now recognizing, continue to do what you've done, you'll get what you got, which is some very impressive success, but not at the scale of the challenge. Darrell Steinberg referenced, Mayor, more contemporary histories as it relates to deinstitutionalization, but this was not one single act that occurred. This was a series of acts that occurred over a course of many, many decades. I remember 1963, there was a community Mental Health Act that was signed by then President Kennedy. And then there was a guy named Ronald Reagan, 1967, the year of my birth, that with good intention and a bipartisan piece of legislation, LPS, Leonard Petra Short Act, talked about this vision that was amplifying the vision of Kennedy as it relates to community-based alternatives and not coercing people against their will in large mental institutions. I remember a few years later, perhaps one of the most consequential decisions that we continue to be reminded of, and that was the O'Connor versus Donaldson decision, the Supreme Court decision in 1975 that said legally we can't hold people against their will simply because of their mental illness. There was a push from the left and the right as it relates to the institutionalization. But we failed in the application, in the implementation of strategies to fund it. Carter infamously promoted some good work. Then President Reagan came in and said, no, that's states' rights, and basically outsourced it, further exacerbating the conditions ultimately leading here today. My point is, at a certain point, we got to stop pointing fingers, and we need to look in the mirror and take some responsibility. We have agency. We can shape the future. Those are all interesting and stubborn facts, but here we have the opportunity to reimagine and to advance that original vision. And that's what this is about. That's why we want to provide a bond component so we can provide minimum of 6,000 new beds, 6,000 new placements across the spectrum. So we have the ability to decompress institutions, Ken, like yours, have the ability to have a place where people can go for longer term, not just short-term support and care. This is exciting. I mean, end of the day, perhaps this is one of the most consequential things any of us can be involved in, because this touches every single one of you, every single one of us. There's not a human being here that can't lay claim to some relationship to this issue, some more intimately and personally to the issue of mental health and stress. The stacking of stress you all have been dealing with the last few years, it's remarkable we're all here. You know, people need to take care of themselves. It was even before COVID, the Surgeon General said the #1 preventable disease in the United States of America is social isolation. I mean, feeling lonely before the pandemic. So this is important. I just lost someone I went to the prom with to suicide a couple weeks ago. I mean, that's just, forgive me the personal example of that. I lost my grandfather to suicide. Came back, prisoner of war, completely changed man. And that's why veterans are front and center in this. And I appreciate all the extra. I mean, that's why we're here. No one does it better than folks down in San Diego, having the backs of our veterans. And so there's a big component here to make real the promises that we promote all the time about how much we value our veterans as it relates to these issues. A big component of the bond is getting serious about that and taking it to the next level. So I'm all about being accountable. We own this. We own this moment, but we have now the tools and the capacity to turn this ship around. And it's because of the folks you see behind me. And thank you. I'm glad they came out and did and expressed themselves today. Madam Pro Tem, this will not happen without you. Senator Eggman, this will not happen without you. To your remarkable new Assembly member, he's not even that new, my old friend, this will not happen without you. Supervisor, will not happen without you. To, Mayor of Sacramento, the author, his moral authority is foundational in advancing these reforms, but more important than anyone else, not going to happen without each and every one of you. And that's why we entrust this process will be inclusive. NAMI, thank you, of your lived experience and your advocacy and others as we shape this and organize a framework. We're going to win this thing come November 2024. We're not going to fall prey to waiting till 2024 for this ultimate decision. We're going to continue to build on the great and impactful, meaningful, incremental progress that we've been making. But this is a big idea. It's half a century overdue in the state of California. It's time to fulfill the vision that was laid out in the early and late 60s. And that's why I'm here, and I couldn't be more proud to be here with all of you on this very meaningful day as we socialize these efforts. Thank you all very, very much for all of your leadership, and thank you very much, all of you, for your support. With that, Secretaries Galley and Little Ortiz is here, others, to answer any questions, and of course, I'm happy to answer any as well.
Hi, Governor Newsom. Thanks for taking questions. Hannah Wiley with the Los Angeles Times. Just a quick question is, how much are you planning to raise through this bond measure for the housing construction? And then with the reconfiguration of funding for that $1 billion each year to go toward supporting this housing, how do you plan to retool or reconfigure funding for other services as well? Is it going to be pulled from other services, or how are you anticipating the funding restructuring to go?
We're working with the counties in real time, working with the cities that feel they should be driving this as well. That's a huge issue, as you know, the relationship between cities and counties. Working with the author now, I think we're on our 4th year of this conversation about reforming together, and we've advanced a lot of those conversations. We're working with CSAC and our partners. We're working with CBOs and the CBO networks. But here's the thing. We're stubborn. We're about prioritization. We're about accountability, and we're about addressing that fundamental vexing issue of what's happening on the streets and sidewalks by putting some real accountability and real focus in that space. And again, that's that integration on the housing and service component. And so we want to drive a focus in that area. As these dollars grow, we're about $3.88 billion that we're estimating in this fiscal year. Even with the economic slowdown, we're still projecting close to $4 billion. That pot continues to grow, so it's not a scarcity mindset. It's more of an abundance mindset, but we do value reprioritization. Otherwise, we'll continue to get what we've got. I'm not interested in status quo ante. I want to see real results, real accountability. I want to see a drive to the housing linkages and fundamentally focusing on these chronic conditions. And so that's the thrust of what we're trying to advance. And I will step aside and ask former Senator Steinberg and now Mayor Steinberg to talk a little bit more about some of his advanced conversations and his stubbornness in this respect.
Thank you, Governor. So we talk about, there's this term, and I think it's an inside term, but maybe everyone needs to know about it. It's called full service partnership. It's the coin of the realm. It's what the Mental Health Services Act was intended to do and has done. The counties, working with the nonprofit providers, have built close to 100,000 full-service partnerships during the course of the act. Those are 100,000 people whose lives are much better, if not saved, because of that intervention. But here's the secret, and we don't talk about this enough. When you break down those full-service partnerships, the people who are getting them are in need. They're sick. But there is not a strategic focus on the tent encampments, the people who are chronically homeless. And you know why? This is really the elephant in the room. Is this a private conversation, by the way? This is really the elephant in the room. The reason why the counties and the nonprofits and everybody have not focused on the tent encampments with the MHSA dollars enough is because it's really hard. Because it's really hard. It's not creaming to say that you're going to help people, preventing them from becoming homeless. The counties are doing a good job. But this is a matter, as the governor said, of prioritization. If chronic homelessness, alleviating it, is the state's priority, then we must put the resources that are available into that problem, because that's where the money is. In addition to a lot of the resources, obviously the billions of dollars that the administration, the legislature have put forward, the ongoing source of money is CalAIM, and it's the Mental Health Services Act. And so together, put that money towards the tent encampments and get people off the streets who are the sickest of the sick. And the counties, you know, some of them, like Nathan Fletcher is really important because he's bold, and there are a lot of great county leaders. And they put forward an interesting proposal themselves this week on accountability. I think there's an opportunity for new partnership because the counties are suffering as well. The cities certainly are. The public is crying for change. The governor is leading that effort, but we can no longer have the bulk of these full-service partnerships focused on other than most chronically homeless people. Last thing, the money's growing. It doesn't have to be a choice between this or that necessarily. The counties are planning 2-3 years ahead with the growth in the money. It went from $750 million to now $4 billion, and it's going to grow. The millionaires are doing okay in this state. And so let's take that growth money. That growth money could pay for the $1 billion in the housing, just to start.
And Nathan, you want to? You live in the county.
Why?
Life.
No, look, I just think look, counties, at some point there's a structural problem, right? And you have some counties and some cities that are moving and some that aren't. But at the end of the day, you need the structural requirements to ensure the prioritization happens and make sure that the allocation of resources goes where it needs to go to the greatest need. And these are challenges we can address. But again, it takes that prioritization and that requirement. And so everyone in local government, no matter what issue you're talking about, will always say, well, don't require us to do anything or don't hold us accountable, let us do what we want to do. But at the end of the day, that hasn't been getting it done. And so some change is going to have to be required. And every elected official at every level of government should be willing to say, yes, hold us accountable. Point us in the direction that we're required to do, because in government you do what you have to do first. And after what you have to do, you do what you want to do. And so I think that this is an important change. And there are examples where we had a tent encampment on Magnolia Avenue in the unincorporated where we had both land use authority and our county responsibility. And we went out every day for 21 days and we engaged folks. And we said, hey, you can go to the shelter, you can take the motel voucher, but you can't stay here. We can't have an encampment. And every day social workers. And we showed up 21 days later, the sheriffs, and nobody was there. People took shelter. They took motel vouchers, and then we took that location and we turned it into a safe parking lot. So that site now doesn't serve as an encampment, it serves as a place to address homelessness. But there are going to have to be greater requirements on cities and on counties that require them to address these, because then again, in government you do what you have to do first. And so I think more accountability, more requirement, a higher prioritization on the toughest, most difficult to serve population. We supported CareCorp as a county early. We said, hey, that's fine. Let's require us to tackle these needs. And so as someone who struggles every day with siting facilities, funding facilities, staffing facilities, and I see all the challenges and hurdles, I think the more prioritization we can have in China law and the more accountability we can have, the better outcomes we'll get. And so I really appreciate all of these actions.
Belaboring this any further. There's $11.6 billion we're investing in the behavioral health system this year. And this is one component. We're putting unprecedented resources. I just mentioned one modest component as it relates to the children initiative, but CalAIM, I mean, that's about integrating brain health and physical health. That's about changing the entire paradigm and focus of the Medi-Cal system and capacity to get reimbursed or at least partnerships with the federal government. That's part of this new stacking. So Dr. Galley, who's been just really the visionary in so much of this, and I cannot impress upon you more how proud I am of Mark Galley and how honored I am that he's the head of the Health and Human Service Agency. He's been making this point that we have been building out a vision that's much more inclusive than just this issue in isolation. It's about 30% of the annual spending, of the overall spending, just in the Mental Health Services Act. We're looking at an entire continuum that will also continue to stack and grow, that will support the counties and any anxiety they have.
So I just want to make sure, how much are you trying to raise with the bond measure on the ballot?
$3 to $5 billion. We're landing on the exact number. We're integrating the veterans component, and that's where we're working on exactly where to land. Right now we're looking at supporting minimum 6,000 beds. That's gone through a multi-year needs assessment that would provide support for 10 to 12,000 individuals each and every year. We've regionally identified, so we stack these in a regional way, and that we make sure they're state-of-the-art, 21st century regional centers of support and beds, so that we never go back to the old sins of the past.
$5 billion. Okay, thank you.
Hi, Governor. Gary Worth, San Diego Union Tribune. I think you said 6,000 units was the goal for this to raise, but I was wondering how many of that would be for veterans, because I think you just said 6,000 veterans would be served by it. And so is there an estimate for the need for how many beds there actually are needed, that is, now for mental health services?
No, in fact,
in
that
the state?
6,000 comes to that needs process. Dr. Galley's been working on this for years. He can talk more specifically about the 6,000.
So 6,000 beds represents a number of beds that we're looking at across the continuum. These can come in a number of different varieties. You might see some built up in a campus-style setting that supports individuals to get intensive services on site. You might see some that are much more residential, depending on services both in that building per se, as well as in the community. And then in the scattered site model that we've been building, whether that's really behavioral health focused board and care settings or permanent supportive housing units that are supported through these dollars. So the whole concept is we step down. It's a very clinical term of step down, but that's exactly what we're talking about. Today we met individuals who are, for all intents and purposes, stuck here longer than they need to be here clinically because there's no place to go. And guess what? That bed is filled with somebody because there's no other place to go. So the whole vision here is deliver on this promise from decades ago to build up that community continuum. The suggestion is we're going to go for 6,000 beds at all of these different levels. Some of them will have shorter lengths of stay, if you will. Others might really be longer-term residential. And the goal is to ensure that we create these in such a way that we're able to not just depend on MHSA funding or other county dollars, but to really align them with the broad strategies around Medicaid reform that are embodied in large part in what we're doing with CalAIM, in large part what we're doing and pursuing with other waiver opportunities focused on behavioral health. So that is the vision, these 6,000 beds roughly that have been missing. Sure, some are going to be available to veterans, some are going to be available to community members surrounding this facility in all of our homes. Some are hopefully going to be available for those family members that we're worried about every single day. But the goal is to, as the governor said, make these state-of-the-art, human-centered, patient, person-centered facilities where the needs are met in a number of different ways. And it's really a proud moment to be able to talk about this vision, but it's not one that I think Californians haven't sought for some time. It's just today we're talking about how do we actually get it done and delivered.
Thanks, but again, is there an estimate for how many are actually needed right now, for how many beds throughout the state you would need right now to serve everybody?
So I think depending if you're looking at which study, a recent study by the RAND Corporation identified roughly 6,000 beds. Some would say you need a little more. Depending on the variety of bed that you're talking about or the variety of placement, you might need, some might say, fewer of this variety or another. But 6,000, I think, is a very accurate number that represents what we need to meet some of the most vexing issues that bring together the homelessness challenge with the behavioral health system.
Thank you.
That's where that bond goes.
Hi, Governor Newsom. I'm Samia Kamal with Cal Matters. I have a bit of a more general question. Today is the last day of your State of the State tour. I was wondering if you could talk about some of your takeaways.
Are you brokenhearted? I'm kind of extending it down south tonight. I'm heading down to the Salton Sea. But look, thank you to the pro tem and the speaker that indulged me. I just did my inaugural. I thought the last thing they need to hear is me whining on in prepared remarks. And so I thought it'd be more interesting to spend time all across the state and the community highlighting. We've done a lot of events beyond just these 4 days with elected leaders highlighting their great work, and some small venues, some larger venues like today. And so it's novel, just trying to do something to, generate a little bit more energy so people understand what our priorities are. We started talking about the issue of homelessness a few days ago, talking about getting these tiny homes, small homes as we refer to them, up so there's some immediate movement. We talked about the $1 billion we're providing under the Housing Accountability Framework and the new Housing Accountability, or rather homeless accountability plans that were put together. I was at San Quentin talking about a vision, by the way, that is directly related. All of this connects. There's a theme here. If you're not connecting that criminal justice theme, you're not connecting this theme around poverty and all its forms of manifestations, connecting that larger theme around homelessness and housing. And I think those two issues truly do represent the twin challenges of the state, our fate and future. They're connected to more of our challenges than any other two issues. And that's really the thrust of this multi-day effort.
Just a quick follow-up. Could you talk about anything you learned that might impact your policymaking in the future?
Well, I do this every week. You're actually getting to experience my day job. It's not just sitting in my office up in Sacramento. So I love getting out, love meeting people. Down in Watts yesterday, I mean, I have 20 stories from all these little kids that just enliven me and brings me back to my mayor days. So you go through a campaign. Forgive me, everybody, for having even listened to this. In a campaign, you really feel a great sense of connection. Then you get into sort of these routines in office, and it's great to feel like I'm back out again, but in a much richer way, because we're able to not just promote and promise, but actually deliver. And there's some really exciting things that including the insulin announcement we made yesterday. That's a game changer. I mean, that's about market disruption only in California could that happen. And that's why I continue to look forward to extending this to day 5 if you want to join us at the Salton Sea.
Thank you.
Hi, Governor. Daniela with Spectrum News. I'm just curious how you guys are going to ensure that those who need the help the most, the sickest of the sick, as many of you have said, will get the help, not just those who volunteer for it.
No, well, look, I'm going to step aside and let the experts speak to that. But, I mean, that's foundational, right? And I said this, you've heard me say this 100 times. Forgive me again. But state vision is realized at the local level. And at the local level, it's realized in a culturally competent way, neighborhood by neighborhood, communities, large and small. And that's the framework of the stacking of prioritization. And we count on the eyes and ears of the people that are on the front lines to make those determinations. It's not the state dictating one size fits all. Each unique region, county is resourced differently. And that requires then a deeper understanding of the people that are delivering those services directly. Perhaps any of you can amplify that or reinforce or perhaps contradict.
I won't do that. Well, prioritization is a key step towards accountability and the state has a proper role. I believe in local control, but I also don't believe it's absolute. And the state has a right, and I think has an obligation, to say this is our societal priorities. And you can implement them the way you want, counties and cities. And that's exactly what the governor is proposing here today. I also think this is maybe the beginning of an even broader conversation about accountability. I know Supervisor Fletcher in San Diego has pioneered a partnership agreement with his cities. I know in my city we have put forward a legally binding partnership agreement with our county, where the county has obligated itself to do whatever it takes, including adding as many of these full-service partnerships as are necessary based on diagnosing people in the tent encampments themselves. That's accountability. And so how do you ensure that the people who are the sickest of the sick are going to get served? Number one, the state rightfully should prioritize how this money should be spent. And secondly, cities and counties need to come together and bind ourselves to one another and to the results that our constituents want to see.
I'll just add, I'll give you an example I think about a fair amount is, and I said this earlier, you do what you have to do first, and then after what you have to do, you do what you want to do. In the state of California, there's not a second grader anywhere in the state of California that doesn't have a classroom to sit in. Every second grader has a school to go to with a teacher, and a playground and a whiteboard or whatever it is. Now, they're not all equally good, but every second grader has a class to go sit in because you have to do it. It's required. Well, with Care Court, we're going to get to the point where counties are going to have to provide care to those gravely disabled, right? Because you're going to have to do it. And so you'll have individual counties or individual cities that by force of personality or real commitment to an issue will meet that standard absent the requirement, but not across the entirety of the state and not across the entirety of all time. And so I think putting in place the requirements that are there are what are going to force you to build the systems. The other thing that's going to happen is when counties all of a sudden realize, hey, I'm going to have to financially find a way to take care of these individuals, well, all of a sudden there will be a lot more focus on prevention. All of a sudden there will be a lot more investment on that one individual who comes into my crisis system of care, ensuring they don't come back. Because I know I'm going to have to do it and have to pay for it. And so I'm here for all of the accountability, for all the requirements, for all the transparency, and everyone in every local government will always say, well, we don't have enough money, but that'd be true no matter what we do. We always say that. We say that for every issue on everything that ever gets proposed. But at the end of the day, it's going to be about us making a prioritization and making difficult decisions to ensure that those who need help most get it. And I dream of the day where we get to a place where everyone who needs mental health services or addiction treatment can get it quickly, in quality way, in much the same way that every second grader has a class to sit in.
So just to be really concrete also, there's a part of this conversation we haven't had. I'm looking forward to having it, which is about not just accountability, but measurement. And we have not, part of our accountability structure must be about how we measure this differently. We have so long valued just getting the money spent without understanding what the outcomes are for those dollars. Today is that start of that conversation a little differently. So if what we want to do is serve those with the most severe conditions, those who are living in chronic homelessness, then we have to look there. The governor and I were both given and recently read a book called Measure What Matters. How are we going to do more of that in this sphere? So I think a piece of this is going to be, are we going to create the systems, the data collection systems, the reporting, the understanding of how we measure outcomes differently so that we're not just prioritizing it in theory or at a high level, but we're able to produce exactly how these resources get used to achieve the goals being talked about today. So that will be an important piece. I look forward to working with a number of partners, mainly our county partners, to envision what those systems look like, how we use them over time to really be able to measure what matters on this issue.
Hi, Wendy Fry from Cal Matters, and this is the last question. Really, it's 3 parts, though, because a few people sent me questions when they realized it was the last.
3 parts.
But thank you for being here, and thank you for allowing us the opportunity to ask questions. And mine is sort of to the point that the last speaker was making, but just you mentioned the example, the anecdote of the man who is in recovery and surviving from fentanyl addiction. But do we know what the long-term success rate is for substance abuse treatment for fentanyl? Across the state? And then to that end, you know, I'm sure Anita or some of these service providers will tell you, you know, always throwing money at, money isn't the entire issue. There's some gaps in that, like minor children, you're not, as parents, you can't put them in rehabs and keep them there. They have to want to go to the rehab. So how can you address people who do not want the care? And then the final question, sorry, how mental health how mental health will be addressed with delayed workforce funding, please. Thank you.
All right. Tackle some of your lived experience.
So look, 20 years ago, when this act was first passed, I think substance use disorders were left out for reasons that today we would say are all related to the stigma that existed. Today, it's turned some. I would say it's turned significantly. You hear stories of people who have made it through recovery, who are dedicating their lives to supporting others with their addictions. The science is way behind in many ways, but it still has gotten to a place where we have more confidence than we ever have before that we can put out models to support people. The first start is to say this funding can be used to support individuals with substance use disorders, that it can no longer be stigmatized in how we fund the services, and that's point number one. Secondly, working with a number of people, not just in California, but we have some of the greatest leaders in this in California, but across the nation, on what are those new programs, what does it look like to treat substance use disorder better and differently than we did before. If you look at what CalAIM is doing with its connection with a number of novel, not only novel, but even tried and true interventions that now are going to be funded with Medicaid funding, that is a step in the right direction to start to scale those across the state. To the point about making sure that we're able to engage people in the care, the workforce component we can't say enough about. We need to invest. We know that 6,000 beds that remain empty because we don't have the workforce to work in those beds is a shame on us moment again. So accompanying this is a discussion on how we take the dollars that we have to make sure that we're investing in the workforce. We're looking at specifically the substance use disorder field and how California can lift that up, making sure we have strong standards around what those roles and responsibilities are, but we welcome more people into that work. So absolutely, the workforce piece is going to be important. Some of the broader other opportunities connected to this announcement today will help us get there, but that's also on a journey. We know that the workforce doesn't just come down from above. It's going to take months, years of work and investment in those programs, and a number of partners in San Diego and across the state are going to help us get there.
And I'm on my way to an event. You're welcome to join us, where we will release our fentanyl plan. I will spare you the details of that announcement because I want to save them. But I can assure you we are taking it to a whole nother level. And I look forward to showcasing to the people and socializing what we're doing. Look, all of you, thank you for your patience. I know this was a long presentation, but I also think this is a long time long time coming and long overdue. I really mark this moment, I hope, as one of the more consequential moments as it relates to this issue in my lifetime. Thank you all very, very much for being here today.